Nursing care of elderly. Introduction. The lifespan for both male, 65 years, and female, 75 years, has raised significantly, and it is estimated that by the turn of this century, numerically the highest number of old people will be in India. Nurses and health professionals therefore have to be aware of the complexity of the care of elder people. A man's life is normally divided into 5 main stages, namely infancy, childhood, adolescence, adulthood and old age. In each of these stages, an individual has to find himself in different situations and face different problems. The old age is not without problems. In old age, physical strength deteriorates, mental stability diminishes, money power becomes bleak, coupled with negligence from the younger generation. Elderly care. Elderly care, or simply elder care, is the fulfillment of the special needs and requirements that are unique to senior citizens. This broad term encompasses such services as assisted living, adult day care, long-term care, nursing homes, often referred to as residential care, hospice care, and home care. Elderly care emphasizes the social and personal requirements of senior citizens who need some assistance with daily activities and health care, but who desire to age with dignity. It is an important distinction, in that the design of housing, services, activities, employee training and such should be truly customer-centered. It is also noteworthy that a large amount of global elderly care falls under the unpaid market sector. Aging. Aging is the process of becoming older. Aging is not merely the passage of time. It is the manifestation of biological events that occur over a span of time. Aging is a lifelong process of growing up and growing old. It begins at conception and ends with death. So, in this sense, we are all aging from the time of birth. In our younger years, aging is called by other names. For example, in our infant years, we call aging growth and development. In our teenage and young adult years, we refer to aging as maturation. After age 30, our physical body begins to wear out and our functioning declines. Aging is a lifelong process of growing up and growing old. It begins at conception and ends with death. It is the manifestation of biological events that occur over a span of time. Aging includes 3 parts: growth and development, in our infant years; maturation, in our teenage and young adult years; and senescence, after age 30. So, aging should be explained based on these 3 parts. Different types of aging. Aging can be viewed in different way. We need broader views to understand the aging-related issues. In this context, aging is classified as biological aging, psychological aging, social aging, chronological aging. Chronological aging is the number of years a person has lived so far. An 85-year-old lady is chronologically older than a man who is 75 years old. However, chronological age may not match a person's biological, psychological, or social age. For example, the 85-year-old woman may be an active volunteer, while the 75-year-old man could be homebound. Sometimes we say, he looks younger than his age, or she does not act her age. In these cases, the biological, psychological, and social age do not match the chronological age. Biological aging. Biological aging involves the loss of cells over time. With biological aging, tissues and organs are less likely to function efficiently, the body's ability to repair itself slows down, and the immune functions decline, making the body more prone to infection. Biological aging is sometimes referred to as physical aging. A person who keeps fit and gets regular checkups can appear biologically younger than someone who is the same age but does not keep fit. Psychological aging. Psychological aging involves changes in memory, learning, intelligence, personality, and coping. An older person who is mentally active and is able to deal with new situations can be said to be psychologically young. Social aging. Social aging refers to changes in roles and relationships as we age. For example, it is not unusual for older people to gain new roles, like becoming grandparents. or they may change roles, from an employee to a retiree. With role changes in later years, society may expect people to behave in certain ways. So, for some people, it may not be proper for grandma to go roller skating or bungee jumping because these are things that young people do. The social age of a person in a given context can be very important because it shapes the meaning of aging for the person, and this can make aging a positive or negative experience. Functional aging. It is related to how people compare psychologically to others to similar age. Category of older persons. With increasing life expectancy and number people increasing day by day in the 60+ category, age 60 years and above is also further classified for the demographic data collection and for other purposes also. In the Western and developed countries, chronologically 65 years is considered as beginning of aging, and accordingly the aging can be classified as young old, year, 65 to 74. Middle old, year, 75 to 84. Old, years, 85 plus. Centenarians, 100 plus. Normal biological aging process. The aging process is the gradual, decreased ability of the body to function and to heal itself. As our body age, they naturally deteriorate in the late years. Many essential functions begin operating at a suboptimal level. There are three main factors that influence the body's aging process. First, as we grow older, the number of mistakes incurred by daily cellular reproduction increases. The body actually creates non-functional cells, leading to more rapid deterioration of the body's functions with advantage age. A large percentage of our cells, even though they were present, are useless. These non-functional cells sometimes interfere with normal cellular process. The second part of the aging process related to cellular damage that causes the shortening of DNA. As time passes, increased damage to healthy DNA leads to accelerated cell death, and our old bodies simply cannot generate cells fast enough to compensate for the loss. This process is most visible and obvious in our skin. The older we get, the thinner our skin becomes. The third part of the aging process involves the cellular deconregulation of our national oxidative enzymes such as superoxide dismutase and catalase and glutathione peroxidase, making our antioxidant defense less efficient with age. Mechanism of aging. The genes determine the lifespan. Genes may have a role to play in the aging process. Wear and tear of important organs by continuous functioning. Accumulation of toxic materials, e.g. cholesterol, in the vital organ like heart, brain, eye, and thereby damaging them. Loss of important genetic material during DNA repair. Accumulate of stress over lifetime with its resultant effects. Exertion of production and deficiency of important hormones, e.g. growth hormone and androgen, estrogen and thyroid hormones. Evaluation of aging helps to explain why survival, reproductive success, and functioning of almost all living organisms decline at old age. Factor affecting aging. Three types of factor that mainly affect aging: genetic and environmental factor, lifestyle and disease. 1. Genetic and environmental factors. The aging process depends on a combination of both genetic and environmental factors. Recognizing that every individual has his or her own unique genetic makeup and environment, which interact with each other, that is why the aging process can occur at such different rates in different people. Environmental stress associated with exposure to excessive heat and light trigger the activity of aging genes. However, many environmental conditions, such as the quality of health care that people receive, have a substantial effect on aging. 2. Lifestyle. A healthy lifestyle is an especially important factor in healthy aging and longevity. Behaviors of a healthy lifestyle: not smoking, drinking alcohol in moderation, exercising, getting adequate rest, eating a diet high in fruits and vegetables, coping with stress, having a positive outlook. Aging process in men is mainly brought about by overconsumption of alcohol and heavy smoking. Lack of exercise, inadequate rest or sleep, mental stress show symptoms of early aging. Other factors like regular consumption of excessive spicy food and caffeine renders an old look. Sloth and sluggish lifestyle makes one feel old. 3. Disease. Aging and disease are related in subtle and complex ways. Several conditions that were once thought to be part of normal aging have now been shown to be due to disease processes that can be influenced by lifestyle. For example, heart and blood vessel diseases are more common in people who eat a lot of meat and fat. Similarly, cataract formation in the eye largely depends on the amount of exposure to direct sunlight. Osteoporosis and arthritis are the main factors governing aging process in women. The toxins produced in Parkinson's disease degenerate the neurons that hinders the memory of brain. In Alzheimer's disease, a substance known as amyloid is produced that destroys the brain cells. All these interferes with the normal aging process. Age-related body system changes in elderly aspects of aging. Normal aging has 4 aspects. Biological aspect of aging. Psychological aspects of aging. Socio-cultural aspects of aging. Sexual aspects of aging. 1. Biological aspect of aging. Individuals are unique in their psychological and physical aging process. As the individual ages, there is a quantitative loss of cells and changes in many of enzymatic activities within cells. Age-related a change occurs at different rate in different people. Nervous system. Decreased speed of neural conduction. Decreased number of brain cells. Decrease in cell of the nerve fibers. Decreased neurotransmitters. Decline in memory for recent events. Decreased rapid eye movement sleep. Decreased cerebral circulation. Sensory changes. Eye. Diminished ability to focus on close objects. Decreased visual acuity. The eye's external changes give evidence of advancing age. These changes result from loss of orbital fat, loss of elastic tissue and decreased muscle tone. The cornea flattens, which reduces the refractory power. The retina of older individual becomes thinner because of fewer neural cells and receives only 1/3 of the amount of light that of a younger person. Due to this problem in reading, not able to see in dim light and also have difficulty in color perception. The lens of the eye loses its elasticity and increases in density. Ear. Hearing problem. Cerumen gland are reduced in number, dry and hard ear wax, along with itching. Degenerative changes occur in ossicles contributing to hearing loss. Presbycusis is the term used to describe hearing loss associated with normal aging. Taste and smell. Decreased ability to taste and smell. Very rarely the capacity to smell diminishes. Taste perception and taste discrimination decreases as the age advances. Integumentary system. Decreased elasticity. Decreased secretion of natural oil and perspiration. Thinning of skin. Decreased heat regulation. Decreased protection against trauma and solar exposure. The number of pressure and light touch sensors decreases with age. Immune, vascular and thermoregulatory responses of the skin decrease with age. Loss of hair color and thinning of pubic, axillary and scalp hair. Cardiovascular system. Decreased physical demands and activity of heart. Slower heart rate and reduced cardiac output. Decreased contractility. Impaired coronary artery blood flow. Less oxygen and blood supply to organ, so that it affects the function of organ. Decreased altered preload and afterload. Increased atherosclerotic plaques and blood pressure. Diminished ability to respond to stress. Respiratory system. Respiratory muscles are atrophied and weakened, so reduce the ability of chest enlargement. Short of breath. Increased rigidity of thoracic cage. Residual lung volume. Decreased gas exchange and diffusing capacity. Decreased elasticity and vital capacity. Decreased cough efficiency. Musculoskeletal system. Decreased bone density. Decreased muscle size and strength. Decreased joint cartilage. In aging, the increased parathyroid hormone, Decreased vitamin D and calcitonin also play a role in calcium loss in older people. In women, estrogen deficiency, calcium malabsorption, lifestyle factors, calcium intake and exercise, can result in bone loss. Aging brings decline in numbers of muscles, resulting in reduced muscle mass. The muscle strength also reduces, especially due to lack of exercise. Urinary system. Decreased blood supply and loss of nephrons. Less blood can be filtered by the kidney. Decreased bladder capacity and concentrating. Decreased diluting ability. Increased prostate size. Delayed sensation to void. In female, relaxed perineal muscles. In men, BPH is associated with aging, leads to urinary incontinence, dribbling. Increasing age is also associated with an increase in involuntary bladder contractions, a reduction in bladder capacity and an increase in residual volume. These contribute to development of incontinence in older adults. Weak pelvic muscles causes stress incontinence. Gastrointestinal system. Decreased salivary secretions, loss of teeth. Lose of sense of smell and taste, so decrease the appetite and desire food. Slowing of peristaltic action. Altered nutrition, digestion and bowel function. Weakening of lower esophageal sphincter. Difficult to chew food because of loose teeth. Liver weight and size decreases with age. There is decrease in number of hepatic cells and, as a result, a diminished capacity for metabolism of drugs and hormones. Reproductive system. Changes in women. Decreased breast tissue. Sexual dysfunction. Decreased sexual desire. Vaginal narrowing and decreased elasticity. Decreased vaginal secretions. Changes in men. In male, decreased size of penis and testes. Erectile ability undergoes changes. Takes longer time for erection, amount of semen is reduced and the intensity of ejaculation is lessened. It is not clear that whether the increase in impotence is age-related. 2 psychological aspects of aging. Memory functioning. Short-term memory deteriorates with age. Long-term memory does not show similar changes. A well-educated and mentally active person does not exhibit such changes in faster rate. The time required for memory scanning is longer for both recent and remote recall among older people. This can be attributed to social or health factors, stress, fatigue, illness, but it can also occur with certain physiological changes due to aging. Decreased blood flow to the brain. Intellectual functioning. Fluid abilities or abilities involved in solving novel problems tend to decline from adult period to old age. High degree of regularity in intellectual function present on most of the old age people. Intellectual abilities of older people do not decline, but do become obsolete. Their formal educational experience is reflected in their intelligence performance. Learning ability. The ability to learn is not declined by age. The slowing of reaction time with age and over-arousal of central nervous system are noted in old age. It may lead to lower level of performance in tasks which requires high efficiency. Ability to learn continue throughout the life, although strongly influenced by personal interests and preferences. Accuracy of performances diminishes. Loss and grief. By the time individuals reach 60 to 70 years of age, they have experienced numerous losses, and mourning has become a lifelong process. It is impossible for some of the older age people to complete the grief process in response to one loss before the other loss occurs. Because the grief is cumulative, this can result in bereavement overload. This can further predispose to depression. Attachment to others. The need for attachment is consistent throughout the lifespan. Well-being of senior citizens can be contributed through socialization and companionship. Dealing with death. Death anxiety among the elderly is more of a myth than reality. The feeling of abandonment, pain, and loss may lead to fear or anxiety in elderly. Psychiatric disorders. The later life constitutes a time of especially high risk for emotional distress. Dementia, depressive disorders, delirium, sleep disorders, etc. are the most common psychiatric illness seen among elderly. 3 Socio-cultural aspects of aging. Old age brings many important socially induced changes. Some of those changes have the potential for negative effect on both the physical and mental well-being of older persons. They want protection from hazards and weariness of everyday tasks. They want to be treated with respect and dignity, and also want to die with respect and dignity. In developing countries and Asian countries, the aged are awarded a position of honor that places emphasis on family cohesiveness. In industrialized countries, many negative stereotyped perspectives on aging still persisting. Aged are always tired or sick, slow and forgetful, isolated and lonely, unproductive, etc. Emplacement is one of the area where the aged faces discrimination. Although compulsory retirement has been eliminated, discrimination still persists in hiring and promoting the aged employees. The status of elderly may improve with time as the number of elder person increases worldwide. 4 Sexual aspects of aging. Changes in female. Menopause may begin anytime during the 40s or early 50s. Gradual decline in the functioning of the ovaries and subsequent reduction in the production of estrogen. The walls of the vagina become thin and inelastic, and vaginal lubrication decreases. Orgasmic uterine contractions become spastic. All these changes result in vaginal burning, pelvic aching, irritability, etc. In some women, these changes result in avoidance of sexual intercourse. These symptoms are more likely to occur with infrequent intercourse of only 1 time a month or less. Regular and more frequent sexual activity result in a greater capacity for sexual performance. Changes in male. Testosterone production decline gradually as the age increases. As a result of these hormonal changes, the erection takes place slowly and requires more genital stimulation to achieve. The volume of ejaculate decreases and the force of ejaculation lessens. The testes become smaller, but most men continue to produce viable sperm well into old age. Theories of aging. Evolutionary basis of aging. Aging theories, which mainly has been categorized into 2 main categories. I-era theory. Aging is a result of internal or external assaults that damage cells or organs so they can no longer function properly. 2 Programmed theory. Aging has a biological timetable or internal biological clock. 1 Era theory. Waste accumulation theory. Mitochondrial damage theory. A. Waste accumulation theory. The human lifespan simply reflects the level of free radical damage that accumulates in cells. When enough damage accumulates, cells cannot survive properly anymore and they just simply give up. Genetic mutations occur and accumulate with increasing age, causing cells to deteriorate and malfunction. RNA molecule is highly susceptible to oxidative stress. B. Mitochondrial damage theory. It is well known that mitochondrial DNA is much more oxidized with age than nuclear DNA. Reactive oxygen species are continuously generated in the mitochondrial electron transport chain. 2 Programmed theory. A. Immunological theory. The immune system is programmed to decline over time, which leads to an increased vulnerability to infections, disease, and thus aging and death. It is well documented that the effectiveness of the immune system peaks at puberty and gradually declines thereafter with advance in age. E.g., as one grows older, antibodies lose their effectiveness. Biological aging theories. A. Evolutionary. Once an organism has produced viable offspring, its body is no longer needed. It then ages and dies. Certain genes may be useful in early life but detrimental in later life. Late-acting genes have not been removed because they act after reproduction. B. Physiological. Programmed theories maintain that aging occurs due to intrinsic timing mechanisms and signals, e.g. genetic timers. Stochastic theories maintain that aging occurs as the result of chance or accidental events, e.g. free radical damage. Health problems in old age. Common health problems in elderly. I. Physical health problems among older adults. 1. Cardiovascular system. Hypertension. Ischemic heart disease. Heart failure. peripheral vascular disease, varicose veins, stroke attack. Nursing intervention. Exercise regularly, pace activities. Avoid smoking. Eat a low-fat, low-salt diet. Weight control. Check blood pressure regularly. Participate in stress reduction activities. Regular medication. Respiratory system. Chronic pneumonia. Obstructive pulmonary disease. Dyspnea. Breathlessness. Nursing intervention. Deep breathing exercise regularly. Avoid smoking. Take adequate fluids. Prevent pulmonary infections. Avoid crowds during cold and flu season. Wash hands frequently. Neurologic behavioral. Parkinsonism characterized by tremor, rigidity, slowness of movement. Alzheimer's disease, loss of short-term memory, deterioration in behavior and slowness of thought. Dementia, it is a chronic or persistent disorder of behavior and higher intellectual function due to organic brain disease. Depression, anxiety, sleep disturbance. Nursing intervention. Advice for hospitalization and encourage visitors. Teach fall prevention technique. Environmental safety like sufficient light, proper chairs for seating, elevated toilet seats. Encourage slow rising from a resting position. Reduce the risk of falls. Gastrointestinal system. Problem with speech, chewing and swallowing. Constipation. Loss of teeth. Colon gas and fecal impaction. Diarrhea. Gastroesophageal reflux or hernia. Fecal incontinence, prolapsed rectum. Dysphagia, anorexia. Nursing intervention. Use ice chips. Mouthwash, brush, massage gums daily. Eat small quantity, frequent meals. Eat high fiber, low fat diet, limit laxatives. Toilet regularly. Drink adequate fluid. For appetite, serve food attractively and different types of foods. Urinary system. Renal insufficiency. Urinary incontinence. Urinary tract infection. Enlarged prostate in males. Sexual dysfunction. Nursing intervention. Regular supervision is necessary. Ready access to toilet. Drink adequate fluids. Avoid bladder irritants, e.g. alcohol, caffeine. Practice pelvic floor muscle exercise. Maintain perineal hygiene. Skin should be clean and dry. Apply cream. Clean underclothes. Reproductive system. Female breast cancer, cervical cancer. Painful intercourse. Vaginal bleeding, vaginal itching and irritation. Male prostate cancer. Delayed erection. Nursing intervention. Health and sexual counseling. Advice about personal hygiene. Musculoskeletal system. Paget's disease. Osteoporosis. Osteomalacia. Rheumatoid arthritis. Spondylosis. Complaints of back pain and joint pain. Stiffness of joints. Fractures. Foot pathology, gait disturbance. Nursing intervention. Exercise regularly. Eat high calcium diet. Limit phosphorus intake. Hormones and calcium supplements may be prescribed. Dermatologic. Pressure sores. Herpes zoster. Dermatitis. Pruritus. Nursing intervention. Avoid solar exposure. Cloth dress appropriately for temperature. Maintain a safe indoor temperature. Bath only 1 to 2 times weekly. Excessive use of soap should be avoided. Apply cream for lubricate skin. 2 mental health problems among older adults. Mental health. Changes in cognitive ability, excessive forgetfulness and mood swings are not a part of normal aging. Changes in mental status may be related to many factors such as alteration in diet and fluid and electrolyte balance. Therefore, health professionals must recognize, assess, refer, collaborate, treat and support older adults exhibit noticeable changes in intellect of affect. Some of the common problems: depression, acute confusional state, delirium, anxiety disorders, cognitive impairment and dementia, late life delusional disorder, alcoholism, personality disorder, obsessive compulsive disorder, drug and substance abuse, sleep and rest pattern, coping abilities, dementia. Dementia and acute confusional state usually are the result of organic diseases characterized by impairment of intellectual functions, e.g. aphasia. Clinical manifestations: language impairment, apraxia, difficulty in performing skilled tasks, agnosia, inability to recognize objects, impaired executive function, poor performance, poor judgment and planning. Diagnosis: history collection, clinical examination including mental function, CSF examination, CT scan. Treatment: home health aid to assist in personal hygiene, home cares to assist in housework, transportation. Support groups such as the Alzheimer's associations are often of value to the family. Legal counsel should be recommended to help the patient and family. Depression. Depression occurs in 5 to 10% of community dwelling elderly due to lack of social supports. Clinical manifestations: sleep disturbance, lack of interest, feeling of guilty, suicidal ideation. Treatment: medical and pharmacological management. Methylphenidate 5 to 10 mg at 8 am and noon is often very effective. Treatment should be continued for up to a year because relapse rates are higher in the elderly. Acute confusional state, delirium. Delirium called acute confusional state and progressive to disorientation. Delirium due to hyponatremia, hyperosmolality, hypercapnia. Clinical manifestations: disturbance in memory, thought disorder, emotional changes, disturbance of perception. Treatment: supportive treatment, ECT, electroconvulsive therapy, antipsychotics. Sensory system: people interact with the world through the sense. Sensory losses associated with old age affect all sensory organs. Nearly half of older men and 1/3 of older women report difficulty hearing without a hearing aid. 16% of old men and 19% of older women report difficulty seeing even with the corrective lenses. Sensory problems: decreased visual perception, decreased elasticity of the eardrum, decreased sense of smell, decreased taste perception, decreased touch sensation. Vision: decreased peripheral vision, decreased night vision, decreased capacity to distinguish color, reduced lubrication resulting in dry, itchy eyes. Management: approach people directly, not from the side. Proper lighting can make a big difference. Assist with choosing clothes if needed. Use of natural tear products. Hearing. Auditory changes begin to be noticed at about 40 years of age. Environmental factors such as exposure to noise, medications and infections as well as genetics may contribute to hearing loss. Hearing loss may cause older people to respond inappropriately. Older people often cannot follow conversation because tones of high-frequency consonants F, S, Th, Ch, Sh, B, T, P all sound alike. Management: reduce extra noise when trying to have a conversation. Place yourself so the person can see you and fairly close. Increased volume not always helpful. Make sure you have the person's attention before speaking. Have doctor check for and remove wax if needed. Arrange for hearing assessment and provide support to use a hearing aid if needed. Taste and sweet. For basic taste, sweet, sour, salty and bitter are particularly dulled in older people. Changes in the sense of smell are related to cell loss in the nasal passage and in the olfactory bulb in the brain. Environmental factors such as long-term exposure to toxins, dust, pollen and smoke, contribute to the cellular damage. Management. May enjoy smaller attractive meals, help to smell food preparation. Serve the food in attractive ways. Skin. Age-related changes, the thickness of epidermis decreases along with loss of moisture, making the skin dry and rough. The melanocyte number decline, which reduces protection against sun rays and leads to appearance of small hypopigmented spots. In the dermis, the fibroblast number and the production of extracellular matrix decreases, causing wrinkling of the skin. Scalp turns gray due to loss of melanin. Growth of nails slows down. Management. Use of moisturizers or bath oils can make bathtub slippery. As a care provider, keep nails short. Pat gently when helping to dry after bathing. Bottom of feet may be sore. Pay attention to foot gear. May feel cooler than others but be more at risk of sunstroke. Use sunscreen hats, long sleeves. Be careful with such things as hot water bottles. Health promotion in elderly. Health maintenance and health promotion is very important. In health care of elderly, following points are included: exercise and activity, nutrition and diet, stress management, self-care and responsibility, community services, exercise and activity. Balance between exercise and activity is most important for elder person as it decreases risk of many health issues. Exercise also improve nutrition and reduce stress. In addition, it decrease risk of hypertension or maintain blood pressure in hypertensive elder person. It increase oxygen saturation and increase lungs capacity. Elder person should do exercise on regular basis as tolerated. They should do light exercise like walking and slow running. Nutrition and diet. Maintenance of nutritional status in elder persons are also important because with increase in age, digestive capacity diminish. The nutrition should be well balanced, that has higher amount of calcium, iron and other essential nutrients. Following things should be considered by elder person regarding diet. Meal time should be kept simple and calm. Food is cut into small pieces to prevent choking. Liquids food may be easier to swallow. Temperature of the food should be checked to prevent burns. Encourage for good mouth care. Avoid alcohol. Review all prescription and over-the-counter medication with patient and evaluate nutritional status. Stress management. By the time individuals reach 60 to 70 years of age, they have experienced numerous losses, and stress has become a lifelong process. In addition, hormonal changes also cause stress among elderly. So stress management is essential for them. Long-term stress causes hypertension, stroke and heart disease. Explain older person about stress management techniques like yoga, exercise, meditation, etc. Self-care and responsibility. Older person also needs to learn about self-care and responsibility. So, following instruction can be given to them about self-care. Monitor blood pressure and blood sugar regularly. Diet control and balanced diet. Stop alcohol consumption and smoking. Get vision and hearing checked periodically. Advised to take proper rest and sleep. Exercise regularly. Community services. Many community supports exist that help the older person maintain independence. Informal sources of help, such as family, friends, the mail carrier, church members, and neighbors, can all keep an informal watch. Area agencies on aging perform many community services, including telephone reassurance, friendly visitors, home repair services, and home-delivered meals. Homemaker and chore services can be obtained at an hourly rate through these agencies or through local community nursing services. Most commonly used services are as follow: Group Counseling Center, Adult Day Center, Rehabilitation Center, Hospice Care, Ambulatory Care Center.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.